Welcome to Learn Medical Spanish. Today I'll walk you through some phrases you could use to guide your patient through a laceration procedure. So if you're going to stitch up their cut, here's some stuff you might want to say. So as usual, I'll start by saying the phrases in English and give you some time to think about the translation, and then we'll say it a couple times in Spanish so you can repeat it out loud for practice. So here's the first phrase. Wait here, please. Think about how to say that in Spanish. Espere aquí, por favor. Espere aquí, por favor. Give us a few minutes to prepare everything. Denos unos minutos para preparar todo. Denos unos minutos para preparar todo. And then one of those words is in parentheses if you're looking at the video, and it's the word everything. And anytime you see something in parentheses, that just means you could leave it out, and the phrase should still basically make sense. Next phrase, I will inject anesthetic to take away the pain. Voy a inyectar anestesia para quitar el dolor. Voy a inyectar anestesia para quitar el dolor. It burns for a few seconds, but then the pain goes away. Le arde unos segundos, pero luego el dolor se quita. Le arde unos segundos, pero luego el dolor se quita. And I'm sure you could shorten that phrase a little bit, but that kind of gets the whole point across if you were injecting lidocaine or something like that, to just reassure them that it's not going to hurt forever. One more injection. Una inyección más. Una inyección más. Or just una más, right? Do you feel less pain? This is probably a minute or two later, right, when you're going to check if they're still having pain. Do you feel less pain? ¿Siente menos dolor? ¿Siente menos dolor? No pain, as in, is there no pain anymore? No pain? No hay dolor. No hay dolor. So one mistake you might make if you don't know very much Spanish is just saying something like no dolor, but that phrase wouldn't make sense in Spanish. You need to add something so that it's more of like a real sentence or a little context. So the word hay, H-A-Y, means there is or there are, as in there isn't any pain now. No hay dolor ahora. Something like that would make a lot more sense than just no dolor. We will clean the wound with water or saline. Vamos a lavar la herida con agua o salina. Vamos a lavar la herida con agua o salina. So, of course, you probably wouldn't say both. You'd just pick if you're going to use water in a sink or if you're going to use saline, or you could even use something else, I guess. But generally, that's what you would use. All right, next phrase. Hold it like this, as in any position that you want them to put it in. You could say, hold it like this, and then show them how. So the phrase is, hold it like this. Manténgalo así. Manténgalo así. And that means to maintain it like this. So in other words, maintain it in a certain position. Turn it like this. Dóblelo así. Dóblelo así. And doblar or doble could mean to like bend it as well. So whatever motion or position you show them, they'll probably get it, if you say something like that. Now we will put stitches. Ahora vamos a poner puntos. Ahora vamos a poner puntos. So puntos is the shorter way to say stitches, so you may as well use the short one. But you can also say puntadas. So either way basically means stitches. We will place a bandage. Le vamos a poner vendaje. Le vamos a poner vendaje. And you could certainly say un vendaje. This is just a shortened way to say it. We will place a splint. Le vamos a entablar. Le vamos a entablar. So splint is a tricky word. I don't think there's a consensus about the best way to say splint in Spanish. And so depending on where you are, or like regionally, it could be a lot different. So I asked an interpreter about this once, and she said that she would generally just use the verb, which is entablar. And so that's what I used here. Le vamos a entablar, which would be we're going to splint you or put a splint on you. Tablillo would be the word that sounds kind of similar to that, right? Tablillo would be one of the ways to say splint in Spanish. But patients might not understand that, is what I was getting at. Come back in blank days to take out the stitches. Regrese en blank días para sacar los puntos. Regrese en blank días para sacar los puntos. So let's just say 5. So then you'd say regrese en 5 días, or 7 would be regrese en 7 días. Or 10, regrese en 10 días. So just depending on how many days it is, you could just fill in that blank there. At home, wash with soap and water and cover it with a bandage. En casa, lávese con jabón y agua y cúbralo con un vendaje. En casa, lávese con jabón y agua y cúbralo con un vendaje. So of course there's more you could say about wound care, but this is just one kind of simplified way to explain the whole thing. All right, so that's the end of that one, but I have a whole list of other dialogues you can go through. So if you're on YouTube, you can click that link there to see the whole playlist. It's a whole playlist for emergency room providers in particular. And then there's another link there to the video that explains my CME course. It's just like 1.5 minutes long and explains all the details about the CME course for emergency room providers. And in the video description or the podcast description, if you're listening to the podcast, there's some other links to other resources. So check that out as well. And I'll see you next time on Learn Medical Spanish.